Now I want to introduce Dr. George Delgado, who I had the fortune of hearing him speak, before, well, it was actually after I invited him to speak, but I usually like to know and have heard how people speak before I invite him to a conference, but I invited Dr. Delgado because I was so impressed just what I heard he was doing in San Diego with his medical center. And he's going to tell you all about it, but it just was what, I thought, and I'm more of a businessman, just had a passion for all this because I've been in the business of healthcare all my life. But really dreamed that we had medical centers like Dr. Delgado has set up, and we have them all over the country. And when that happens, we will change the whole culture of healthcare, and we will have a healthcare culture of life. And I truly believe healthcare is the most significant way we can evangelize today. So having said that, I want to tell you a little more about Dr. Delgado. He practices family medicine, providing medical care that respects the sanctity of life for newborns, children, and adults. Dr. Delgado is an NFP medical consultant trained in nanotechnology. Additionally, he and the other members of the staff are available to counsel women who are in crisis pregnancies. Dr. Delgado is also a staff physician with the Elizabeth Hospice Service on palliative medicine, serves at Scripps Memorial Hospital, oh my goodness, in
Encinitas.
I'll let you say it again. And is a hospitalist at Pomero Hospital. Dr. Delgado received his medical degree from the University of California, Davis, and completed his residency at Santa Monica Hospital, UCLA. He is board certified in family medicine and hospice and palliative care. Currently, he is participating in the certification program in healthcare ethics offered by the National Catholic Bioethics Center. Dr. Delgado is voluntary associate clinical professor at UCSD School of Medicine. He is an experienced popular speaker who has made hundreds of presentations to a wide variety of audiences. His topics include abortion, euthanasia, stem cell research, cloning, personhood, and other biological, bioethical issues, and natural family planning. I've had a number of people, ask me, are you going to talk anything, about end-of-life issues and, what we can do, to really, help take care of the elderly. And I know I'm at that stage where that's probably not too far away. In the last, I used to say in the last trimester, but it's even less than that now. So we are going to be hearing about that now, and where that needs to be taking place, I really do believe is, with the primary care physician. Granted, the specialists are all very involved in certain ways in this, but every family needs a family doctor that is there to work with the family and help them at this very difficult time of life. But Dr. Delgado, I just congratulate you for your wonderful work, and I now welcome you to come tell everybody about it.
Much for everybody, and just want to start with a couple of observations and maybe opinions. We were talking yesterday, 1 out of 5 or 1 out of 6 hospitalized patients are in a Catholic hospital, and probably many more of that are treated by Catholic physicians. So why are we getting kicked around? And I think if you look at it, you look at what's gone on in the last 50 years in our country, what's happened is that our Catholic hospitals have become less Catholic. They're minimally Catholic at best, except for a few shining examples like Franciscan Alliance and Gene Diamond. And Catholic physicians are prescribing contraception at the same rate as non-Catholic physicians. And Catholics in the pews are cafeteria Catholics, they're practicing contraception. And Catholic universities are not Catholic anymore, for the most part, maybe a few remnants of those. So that's really the problem. The problem has really been all of us and our Catholic comrades. But what's the solution? The solution is really in this room, if you think about it. And if you think about the remnant of the people of Israel, Jesus came from that remnant. And so Jesus is the solution. We live our lives for and with Jesus. Well, this remnant right here will also offer the solution. I think we just have to remember that we may not be large in numbers, but if we're large in faithfulness, then that's really what's going to bring us back. And we will face persecution, there's no doubt about that. I've told my wife more than a few times that I may end up retiring, going underground, or going to jail. And I think we have to be really ready to do that. It may be a bloodless martyrdom for many of us. It may be laying down our lifestyles, not necessarily laying down our lives. That's still a great thing, and it's for the glory of God, and we have to remember what the primary objective is. So being a pro-life doctor in a pro-abortion world, that certainly has its challenges. And it was just only a couple of weeks ago that a group called San Diego Feminist Occupiers came and occupied the sidewalk in front of our medical building. And so they're out there making a very noisy protest. But not only did they do that, they came into our office, into our waiting room, and took some of our newsletters, and without us knowing it, and then put these stickers in there that had articles that were full of libel and slander and lies about us and what we were doing, saying that we were lying to women and weren't giving them choices. And they took those newsletters and put them back in our waiting room so that our patients picked them up and started reading that kind of stuff. So I want to play a little video here.
Taking.
Good.
Abortion is healthcare. Abortion is healthcare. Healthcare is a right.
Abortion is healthcare. Abortion is healthcare.
There's signs that say abortion's not distortions. I support a woman's right to choose.
Okay, so if you couldn't hear, they were saying abortion is healthcare, healthcare is a right. So I think we're doing something right, though, because we are getting persecuted, so that's a good sign. So this is our website, Culture of Life Family Service. So I'll give you a little bit of history. Our inception was about 11 years ago, and I joined the group about 7 years ago. And since then, we started from very humble beginnings, and now we've moved along. The model that we have isn't necessarily the product of strategic planning and careful thinking. It's more been of trying to survive and keep our head in water. But fortunately, we're at the place now where I think we can do, and we are doing some strategic planning, and hopefully that'll serve us well. This is our mission statement. Culture of Life Family Services is a Catholic 501c3 nonprofit whose mission is to honor God by fostering a culture of life while faithfully serving the community with truth and love through the power of the Holy Spirit. So this is our nonprofit entity. And then we also have Culture of Life Family Healthcare, and I'm going to explain in a minute how those two work together. Our mission is to promote a culture of life by promoting the physical, spiritual, and social health of the community. In doing so, we strive to offer the highest quality of compassionate, personalized medical care to all of our patients. This was an adaptation of our original CULF's mission statement. And I had to come up with a mission statement and a vision statement because patients were coming to our office, and after being there, we're finding out that we don't prescribe contraception and do other things that are contrary to God's design. And so they were very resentful and angry. So I decided we ought to really post what we do on the wall of our office. So we did that. In supporting life and respecting God's design for human procreation, we offer instruction in a highly effective form of natural family planning called the Crate Model of Family and Fertility Care. We also offer nanotechnology treatments, which are aimed at correcting underlying defects in the female reproductive system. So I wanted to tell them what we do, because it's not just what we don't do. but I also had to tell them what we don't do. Because of our ethical and moral foundations, we do not prescribe or refer for abortion, contraception, sterilization procedures, in vitro fertilization, or euthanasia. We only prescribe erectile aids to men, married to women. And in light of this, I may become a test case where the law says we can't do that, right? And finally, we realize that all people may not agree with our mission or our ethical beliefs, and we respect their right to disagree. Our refusal to provide certain services that are widely available elsewhere is not intended to be a judgment on them on our part. Rather, it is simply what we're to offer in good conscience. So this way, we don't want to alienate anybody. We want to tell them the truth, but present the truth charitably. This is our organization chart for CULTS, Culture of Life Family Services. We have a board of trustees, which kind of unfortunately runs our organization by committee, and that's a problem of historical significance because of some of the people who were in leadership positions before had some disagreements with the board. But I think in time this will change. So the board of trustees at the top. We have an advisory board. Bishop Corleone is on our advisory board. Prominent attorney Charles Lamandry and Philip Rivers are on our advisory board. On this side is more of our ministry side, Scott Maxwell with our more PRC kind of ministry, Pregnancy Resource Center. And this is the medical side right here. So we have two organizations and one mission. And this, when I came to the organization, this is the kind of model we had. And so, like I said, I just stuck with it. And we try to make it work. It has its positives and its negatives. The way it works out is that we have the medical corporation doing business as Culture of Life Family Healthcare, and we have the nonprofit Culture of Life Family Services, which serves as an MSO or medical services organization. So Culture of Life Family Services employs all the staff except for the physicians, rents the space, buys all the supplies, and also does all the direct ministry work attending to women with crisis pregnancies and that sort of thing. And the medical group then pays a fee to them every month in order for all these services. And so the advantages to this is there's less risk to the physician side because we don't own anything, we don't hire anybody, we're not responsible for anything except for the medical care. The negative of it is that the medical group can't control everything like you would want a medical group to, how to run your office and things like that. You have other people sort of telling you how they want things done. And when you run by a committee, you have different voices telling you what you want done. And so that can be a little bit difficult and inconvenient sometimes. So in part because of that, but also because of the difficulties of the delicate balance of having two organizations, one for-profit, one non-profit, what we're doing now is we're going to form a community clinic. And in California, there's a corporate practice of medicine law, and maybe similar in other states, where an entity cannot employ a physician to practice medicine unless that entity has a license to practice that kind of medicine. The community clinic is one of those. So a community clinic are a nonprofit, so we're already a nonprofit, so that's good. Can employ physicians. And one organization would avoid confusion. People are a little bit confused now when they see Culture of Life Family Healthcare and Culture of Life Family Services. They wonder what's the difference. We would avoid that delicate situation of a nonprofit working with a for-profit. And 4 years ago, we tried to make the transition to a community clinic, but we were unsuccessful because the process was so labor-intensive that our office managers got overwhelmed with it. And at that time, we weren't as stable as an organization, so we really couldn't take the risk of doing that.
Is it non-profit or for-profit? No, is it
Non-profit. Community clinic is non-profit, yeah. Okay, so let's move along now and let's see what else about Culture of Life Family Services. We have two locations, one in San Diego, the other one in Escondido. A little touchy button, sorry about that. And this is a list of what we offer, and we go through this. First of all, it's important that we offer Christ-centered health care. That's the most important thing. Everything we do or say is related to our mission to serve Jesus Christ. And you see that we're holistic. We have a medical component, a spiritual component, a social component, and a psychological component. We see a person as being more than just a medical problem. And everything we do, teach, or advise is in accord with the magisterial teachings of the Catholic Church. and we're not shy about stating that. We offer comprehensive primary care, prenatal and postpartum care. We used to deliver babies, but about a year and a half ago we lost our obstetric backup, and since we're family physicians, so we have to have that to deliver babies. So we're recruiting an obstetrician gynecologist right now to join us. And but right now we have a system worked out where we provide the prenatal care. The obstetrician sees the patient one time at 34 weeks. If everything's fine, then we continue the prenatal care. They go into labor, they go to the hospital, they've met the obstetrician once, they deliver. The postpartum visit, though, is with us, so that way the obstetrician can't talk to them about contraception. And they've agreed not to talk about contraception or sterilization. And it's a Catholic hospital, so they can't do sterilizations there anyway. So pretty safe position, probably the best of what we can do right now. Newborn, children, and care adults. I kind of like this. Teenagers tired of being hassled by your stupid parents? Act now, move back, get a job, pay your own bills while you still know. So we practice family medicine, take care of our family. We also offer the CRAPE model of fertility care services, and I'm not going to go too much into this, but I think Dr. Hilgers and Barry Davenport are going to talk to you about this. But essentially, this is the most medically adapted form of natural family planning developed by Dr. Hilgers, my mentor right here. We're so honored to have him with us. And the studies show that for avoiding pregnancy is as effective as birth control pills and all the technological methods of contraception. Napro technology, here's Dr. Hilgers' website. I'm going to skip over this a little bit because he's here and he can tell you much more about it. Let's give him a round of applause. This is just my take on napro technology. The approach with napro technology is to identify underlying defects and correct or treat those defects while respecting the integrity and dignity of the woman, the marriage, and the conjugal relationship, at no time impeding, destroying, or circumventing the natural fertility system. Just a wonderful model that he and all of his colleagues have developed. This is our napro technology team. Dr. Karen Soroka is my associate. Pat Poindexter is here in the audience today. She's our director of CRAPE model and napro technology services, and just a great asset to the pro-life community. Okay, crisis pregnancy services. I want to show a short video right now. It just gives you a flavor of what we do in that respect.
I was just partying most of the time, drinking, and I went to the wrong house and something happened in between that house and I got pregnant and my whole life changed with that.
Our first priority is a woman who is in a crisis pregnancy, and that's a woman who is either considering or is being pressured to have an abortion. And we feel that she needs a lot of love and support, all the love and support in the world, so that she can do what her maternal instincts drive her to do, and that is to protect her unborn child.
I was actually contemplating abortion. I went to the abortion mill 3 times. So when I was outside, I met a girl outside, the pro-lifer, and she was explaining to me that culture of life, they take care of people in this type of situation. So I came here and I decided the first decision was to keep my child because she never asked to be here. So I was like, okay, so I'll keep it. But talking with a person from Culture of Life, basically she got me to open up to adoption because I knew I didn't want the baby.
Once then the woman has decided to protect her baby and choose life, then of course we want to help her with the prenatal care, and we have that and offer it and do it very well. And then we may need to make other referrals. Some of these women are kicked out of their houses if the parent or the husband or someone else doesn't like the idea of the pregnancy. And we have good relationships with different charitable agencies who can get them a place to live almost the next night.
Going through the abortion clinic, I felt nobody cared. I even told them that I felt like I was being forced to do it because a father told me I had to do it. So from going from that situation to coming to here and them caring about me and giving me the ultrasound that I can actually look at and see and showing that there was a human being inside me, And when I seen the baby, it kind of made me sad to think that I would even try to do that. And I felt remorseful, but I felt happy in some kind of sense, content that I didn't go through with it. And I can actually see the kid, my kid, in the TV actually jumping around, playing, you know. And she was very active. She was really jumpy and waving. And that's how it was.
Because I've had so many women tell me how much they regretted their abortions, but I've never had one instance of a mother tell me she regretted giving birth to her child.
They're wonderful people. They gave my baby life, and without them, I don't know where I'd be. And they actually put happiness in my eyes. They gave me hope.
These women, when they do, let's say if they give the baby for adoption, they feel that they've really given their child a chance to fulfill their own lives and to achieve something in life and to just make a change in this world. And they also have a great sense of satisfaction that they've chosen, although a difficult choice, to part with the baby. They know that that's the best thing, and it's been a sacrificial choice of sacrificial love that really, they feel very proud of themselves and have a great sense of well-being about it. So I see that all the time.
She's 2 now. She's energetic. She knows sign language. They take her everywhere. They take her to Spain. I was like, wow, I haven't even been there. They just teach her everything. They're very on hand. She has her own playroom. She has her own room. Like, she's really spoiled. And she's the only girl in the family, so yeah.
'Cause I'm letting go to drown in your grace. I'm letting go to drown in your grace.
Okay, so that gives you an idea of what we do and the hearts we've touched through the grace of God. We've been able to be His humble instruments. And these are some of the difficulties that women face when they're in crisis pregnancies. Our culture does not value human life. The embryo and the fetus cannot directly communicate with their mothers. Pregnant women often feel trapped, like there's no way out. Even when they acknowledge abortion is wrong, they often feel it's their only option. So many times they've told me that. I know that I'm killing my baby, but this is the best thing I can do. So that's such a spiritual and emotional poverty to feel trapped like that. The husbands and the partners often coerce or pressure them to have abortions. They may feel that they can't care adequately for their children. And adoption is often dismissed out of hand. And I've really found that to be very interesting. They often tell me, well, if I'm going to keep the baby for 9 months, I wouldn't be able to part with it then. So they often have in their mind sort of a demarcation, a line where they make a commitment, and after that commitment, they really they can't part with the baby. But before that line, they certainly can do away with the baby. They often don't believe or understand that the zygote, the embryo, and the fetus is a human person just like all of us. And I've often seen that women with medical problems often have the risks of pregnancy and delivery exaggerated by medical professionals. And this is really unfortunate. Often women who smoke, take drugs, or take prescription medicines while they're pregnant, they have a great fear that their baby's going to be deformed, and they feel that it's a better option to abort the baby rather than having a defective baby. So they often feel trapped and all alone. We get referrals from a lot of different sources. We have a very good relationship in San Diego County where we have really a strong network that's almost a seamless network. Crisis pregnancy centers, sidewalk counselors. These sidewalk counselors are prayer warriors, and they're very well organized in San Diego County. God's helpers of God's precious infants is a group down there. And they stand in front of the abortion centers, praying the rosary, and they have very specially trained counselors who try to engage these women, talk to them, much like Walter Ward was doing up in Oakland. And when they get them to stop and change their minds, and they send them to us, and often the same day. We're on call on Saturdays and open a couple of Saturdays a month, and so we try to be very available for them. We also get referrals from clergy, from the telephone book, internet, and others. So we encourage them to choose life and to see the humanity of life in there. And we try to charitably present the truth, because again, you can present the truth in a way that's going to alienate people. We try to always be very charitable, but always giving them the truth. And we give them factual information about abortion, about the real medical, the spiritual, the social, the psychological risks of abortion, the increased risk of breast cancer, increased risk of preterm delivery, all the things that they will not be told at the abortion centers. And you know, it's interesting, at these abortion centers, they don't tell them the truth. They don't even let them see the truth. I was doing an ultrasound on a woman one time, and I said, here, look, here's your baby. And I knew that she had been to the abortion center the day before and had an ultrasound. And I was pointing out things, and she was really amazed. And I said, well, when you had the ultrasound at the abortion center, did they show you? And she said, no, they didn't. They had the monitor turned away from me. So they don't want them to see the truth, and they don't want to tell them the truth. And we provide ultrasounds. We have a couple of high-resolution ultrasounds, show them the humanity that's living in their womb. And how do we help specifically these women? Last year we helped over about 120 women who were abortion vulnerable or abortion intent. We do a material needs assessment, encourage adoption in certain cases and at the proper time. And we have a new program of assigning older women as mentors to partner with these girls. Because it's not just a matter of getting them to choose life. We really have to be with them the entire pregnancy, even after they deliver. Okay? Because we want to make sure that they're stable and they have all the support they need. We've assisted women with all sorts of material needs. We don't require them to pay for our services. And if they do not choose life, we still offer help with post-abortion recovery. So we don't just abandon them just because they haven't done what we've urged them to do. This is our pro-life team on the more the ministry side. Scott Maxwell, Director of Development. Debbie Brittles, an RN. She's had public health experience, so she's really ideal to serve in this role of being a mentor and sort of like a social worker for these women. And then their support team is Ashley and Levita. All right, how about spiritual counseling? Our spiritual director is Deacon Ken Finn, who's been just a warrior in the pro-life movement for many, many years. There's no charge for this. We have faithful Catholic volunteers, mostly deacons and deacons' wives who do this. And they meet in the office or talk by telephone. And this has been very well accepted by people of all faiths. There's Deacon Ken and Marie Finn. We refer to psychologists that we can trust that will not mislead people who are faithful Catholics and who will present and take care of these patients in a way that won't encourage divorce or other things that can harm families. And we have a lot of pro-life outreach and education. Talks and presentations, pro-life panels, seminars. We are very happy to have a pro-life white mass being scheduled. That white mass is a mass for healthcare professionals. Our new coadjutor Bishop Flores has agreed to celebrate this mass for us in October, so we're really looking forward to that. And we're planning on having a CMA guild coming soon. We've had, like Thomas McKenna said, we've had the enthronement with the St. John relics in our office, and we're very proud to be a part of the effort that he's leading there to try to bring more physicians into closer contact with their faith. I'm a regular guest on Catholic Answers Pro-Life Open Forum, different publications. I'm often asked to be on television and radio for interviews when pro-life topics come up. And like Mike said, I'm completing the bioethics program at the National Catholic Healthcare Center. And so I get a lot of consultations in person, by telephone, and email bioethical matters. Here's the last thing I want to talk about. It's a new initiative, abortionpillreversal.com. And many of you may be aware that a large number of first trimester abortions now are being accomplished medically with RU486 or mifepristone, the abortion pill. And so we've had an experience in our practice and with helping others to use progesterone as an antidote to mifepristone. Because mifepristone works by blocking progesterone receptors, and so I had the idea, well, maybe if we outcompete that with progesterone, which is what naturally binds to those progesterone receptors, maybe we can help these women and give them a second chance. So lo and behold, we've had success with that, so we decided we would set up this website and hotline to help women anywhere in the country, or possibly anywhere in the world, who are in this situation. They change their mind, they can go online, and we can connect them with a physician in their area who can administer progesterone. So I'm going to go into this a little bit. If any of you out there who are interested, I'd like you to please contact me. I'd like to get as many healthcare professionals on our network as possible to help these women.
How soon do they have to take that after they've taken it?
I'm sorry?
How soon do they have to take the progesterone?
How soon do they have to take it? We've had a patient up to about 72 hours where she got her first progesterone dose and the baby survived. So we want to get it as soon as possible, but we had that far out. Okay, just a quick thing about mifepristone. It's used up to 63 days after LMP off-label, and sometimes even longer. And this is the protocol that's generally employed in the abortion centers, followed by cytotec or misoprostol to cause uterine contractions to expel the remaining. So considering this protocol quickly, the molecular weights of progesterone and mifepristone are similar. The half-life of progesterone is 25 to 55 hours, similar to the mifepristone half-life. Mifepristone and its metabolites can be measured up to 72 hours after an ingested dose. And mifepristone binds twice as well to the progesterone receptor than progesterone does. So therefore, I thought that maybe we should dose the antidote about twice that of the poison and get it in there as quickly as possible. We borrowed a lot from Dr. Hilger's protocols. This is his textbook, or his textbook will be listed next, but relied heavily on that. And this is our suggested protocol to give, give 200 milligrams IM of progesterone as soon as possible. Perform an ultrasound as soon as possible to confirm viability. You don't want to be giving progesterone if the baby's already died, of course. And then if it's less than 6.5 weeks, you may not be able to see the heartbeat, so you may want to measure HCG levels serially to see if those are increasing the way they should. But they may not increase according to the textbook if they've taken mifepristone, so I wouldn't use that as a total means of diagnosing a viable pregnancy, at least not straight off. And then repeat the progesterone 200 milligrams a day for 2 more days, then every other day until 14 days after the ingestion of mifepristone. And then twice a week until the end of the first trimester, according to the nanotechnology protocol. However, at least now, until we have more experience, I would suggest not cutting back the dose until at least the end of the first trimester. And then these are the references of Dr. Hilger's, his textbook and his website. So I think in concert with the toll-free number, with some social media advertising, that we could probably link patients with physicians or nurse practitioners who can help. This again is the website, abortionpillreversal.com. So if you want to be part of the network, please again contact me. There's my contact information. Okay, thank you very much for your time and attention.